adenomyosis, right? So I said to myself, before I close that door, right, let me have a baby, because even at that time, I was single. I was single with no partner and no prospects in the offing at the time. And this was something that became an emergency, right? Because my doctor said, you're 42 now, you're soon going to be 43 again. The longer you wait, the more difficult it becomes. So I had to drop everything and just pursue this initiative to have a baby. So yes, to answer your question, I wanted to have a baby before having a hysterectomy. Okay. But at the end of the day, I ended up not going ahead with the hysterectomy. I opted to have a myomectomy instead, which is the surgery to take out the fibroids and also some of the adenomyosis.
Okay.
But I would say that it was like an accidental situation. If I didn't have the medical crisis, maybe I would still be here waiting for Mr. Right and not even do anything at all for my fertility.
I mean, even in this place where you are right now, I'm sure that there are some societal what they call it now, perceptions about, your choices, your decisions and all of that. We'll get to that in a bit. But, I mean, I was going to come and ask Dr. Babatunde to help us with hysterectomy and dermiosis, and then you dropped another one. So let's have Dr. Babatunde come in at this point, because we want to break it down. We want to be sure that we're understanding everything. Well done, Doctor.
Good evening again.
Good evening, sir. Good to have you here.
Yeah. Okay.
Yes.
Hysterectomy, simply put, is when a doctor removes the uterus entirely. So there are many reasons why the uterus may be removed from any woman. One of them is fibroid, for a woman who is no longer desirous of having babies. And there are other conditions like adenomyosis, which you rightly mentioned, because the cure for adenomyosis actually is the hysterectomy. It's more like a radical surgery relative to myomectomy, when you remove fibroid and you still conserve the uterus. So a woman who has had hysterectomy will not be able to carry pregnancy anymore.
Okay. Let's talk about the adenomyosis, because, yes, women now, to some extent are familiar with fibroids. And I believe in this part of the world, women do as much as they can to sort of still deal with a fibroid. But what is an adenomyosis, and why will it push a woman to consider a hysterectomy? How bad is it? What triggers it and all of that?
Now, adenomyosis is a situation in which sometimes you have what lines the cavity of the uterus penetrating deeper into the muscle. So those lining also, they are hormone responsive. As the lining in the uterus responds to your estrogen and progesterone, so also the ones within the muscle, they also respond to that hormone. So in women with adenomyosis, they have a lot of pain during their cycle.
Okay.
Sex also can be very painful. And during their menses also, they bleed excessively, sometimes more than fibroid, either in quantity or in duration. And because adenomyosis, unlike fibroid, doesn't have any clear plane of division in which you can pick and remove. So sometimes when the doctor is trying to correct adenomyosis, there's actually no clear plane. In the process, they can actually remove the entire uterus in an attempt to remove adenomyosis, and that does not also provide cure. So the cure, and to make the woman symptoms free, is actually to remove the entire uterus.
Okay. I mean, again, because I'm thinking about Ms. Adeola's decision and how she decided, why don't I try to have a baby instead? Are there risk factors associated? Like, is it different from a woman who, even though I've heard is not advisable, who has fibroids and still decides to go ahead and take in and have a baby? With adenomyosis, are there risk factors there as well, or is it reduced? Because again, she considered childbirth as an option to the hysterectomy after she heard about the diagnosis.
Well, I think her decision, if you have to go by her decision is to try and have a baby first.
Okay.
Before undergoing the radical surgery. Women with adenomyosis, they also suffer infertility.
Okay, so
in our own situation,
yes.
If you go from the first principle, the cure for adenomyosis is actually to remove the entire uterus.
Okay.
So what it means that if she does not have any uterus, she can't carry pregnancy anymore. So our decision to try and attempt to carry pregnancy, then maybe later have the radical surgery is what informed our journey into starting fertility treatment at the age of 42.
Yes, so my question is, can someone who has that diagnosis still have a baby? Are there any risk factors, or it's you can go, like, you can have that diagnosis and still go ahead and have a baby?
Well, it's possible, but it's a challenge for women with adenomyosis to get pregnant.
Okay. All right. Thank you, Dr. Babatunde. I'll come back to you in a bit, but let me come back to Miss Olunloyo. Ma'am, honestly, I must say that the fact that you are even sharing your story right now, I think it's a huge deal. You know, I can imagine the what was going on in your mind, you know, throughout that whole period. You know, first and foremost, like you said, you had done a lot of work in the field of sexual and reproductive health. And, you know, coming from that wealth of experience, the point where you're then having to deal with some of the challenges with it. Apart from what was going on in your mind in terms of your body, your choices and the options available to you, were you faced with any other external pressures? I don't know, friends, family, anything? Was any of that happening all at the same time, or was just you in your space with your struggles and challenges and choices that you had to make?
Well, I can say for a fact that life was dealing with me at that time as well. And when I say life was dealing with me, I was having other situations at work, which was very stressful. At the time, I was dealing with workplace trauma. I was dealing with fear from insecurity, because at the time I was working in Kaduna. And 2022, if you remember, was when we had a lot of crises on Kaduna-Abuja Road. Remember all those kidnappings, train crash. So I wasn't having the best of time at work at that time. And here I was trying to drop everything and pursue this IVF treatment. You know, it was one of the most turbulent and distressing experiences of my life, I can tell you for a fact, you know. But I was also fortunate because I had a strong support system of family and friends. And when I say family, not a few, because this is not something you also want to tell everybody. I couldn't tell my mom, for instance, because I know that she won't be able to handle it. You know, she would be more worried than I was. And I was dealing with a lot of anxiety and emotional distress. Involving my mom would have made it even 100 times worse. Or more importantly, at that elderly age, I didn't want to send her to a early grave. So I had to hide it from her. So I only confided in my sister, and then I had a few close friends who were there supporting me all the way. And to be honest, if I didn't have that support, it would have been a disaster. It would have been a disaster, but I'm grateful that I had that support, and it was based on the whole experience, the good, the bad of that experience, that led me to to start an organization called Fertility Cliques, because I realized that it was my clique that helped me through that experience to be able to support me and encourage me, even when the outcome was bad or negative, to pursue other areas of my life and, get back up again and heal and all of those things. So it's very, very important for anyone who wants to go on a fertility journey to ensure that they have that support system. And a support system can materialize in different ways. For me, it was family and friends, and even, encouragement from my pastor. For other people, they may not have anyone other than family, or if it's a woman, it may just be her spouse, so it can manifest in different ways. But for me, I had a good mix of a core group of trusted confidence that helped me along the way.
Okay. I need to ask though, I mean, for a woman at the age you were at the time, like you said, with some of the things that were happening, I mean, thank God for your support system, but what was the most difficult thing? What was the most challenging thing about that period for you? First and foremost, I'm asking from the point of the diagnosis. And again, this is not me trying to minimize fibroid, but I feel like, like I said, I cannot possibly do that. I have lost a few friends to maybe failed fibroid operations and all of that. But to some extent, it is, I think, and correct me if I'm wrong, please, I think that it is one of the more prevalent things that happens to women in these parts of the world of a certain age. And so, to an extent, when you hear it, you don't panic, you don't lose your mind as such. Again, correct me if I'm wrong. But then hearing another diagnosis on top of that, and then having to take that decision of, instead of a hysterectomy, try for a child, and then going through the journey of trying for a child with the IVFs and then having them fail. I want to ask, what was the most difficult part of that for you? Because I feel like you must have felt it somewhere for you to write not one but 2 books. So please enlighten us. For women who are going through this thing, is there anything that you experienced that was the most challenging that you're able to come out from that maybe we can learn from?
I would say it was the emotional distress. I consider myself a very strong woman, right? I've dealt with so many life issues. I'm a go-getter, I'm a high-achieving person. But when it came to this situation or this experience, I emotionally crashed, right? Because if I want to summarize it for you, undergoing IVF treatment it's like undergoing a journey where you don't know where you're going to end. And every step of the way, you are anxious because you don't know from when you're stimulated whether you're going to get eggs, even if they get eggs, whether the eggs are viable. So you're going through different layers and different stages where at each point you are anxiously waiting for.
Okay. So the network, again, doing what it does, but we're going to bring our guests back up and take the conversation from there. It's 10:39 p.m. and I have been discussing with my guests on fertility. I have Ms. Adeola Olunloyo, a fertility educator, on the conversation, and I also have Dr. Babatunde Ogunkile, a consultant gynaecologist, on the conversation. Ms. Adeola has been sharing her story about her journey. First and foremost, coming from a career point of view, thinking that, I have time on my hands, and saying, look, I'm just going to do this when I'm ready. Perhaps another conversation that we need to have, because there are women who are in that condition as well, right? Women who are on a career path and all of that, and it shouldn't be a bad thing, right? But then there are also societal pressures, parents, friends, relatives who will say, but you know that you should have been having a child early. But in the event where there is no man and you are waiting for Mr. Right and he doesn't come. It's not wrong for a young lady to say, okay, I'm going to go ahead and move ahead with my career path. But then the challenge, I think, with that is sometimes we're not properly educated as to what we should be doing to ensure that our chances at fertility, when that time does come, when that time does happen, are not affected. So once again, thank you for sharing your story, Ms. Adeola. You were talking about the emotional challenges that you had to face. So was it just the emotional aspects, or were there other aspects to it that, your support system sort of like helped you through? Did you have, for example, I can imagine my mom telling my mom that I want to freeze my eggs. She would literally, let's even say that, oh, I'm coming from an informed point of view now, right? And I'm in my 30s, or some other person who's listening who's in their 20s, who have, this bright career path, and they're following that career path very, very, committedly. And then somewhere along the line, they decide, okay, I want to preserve my eggs. My mother would not hear it. Oof. And there are lots of mothers, I guess, in this part of the world who are not very open to those kinds of things. They would rather do everything that they can to see you married off to somebody than hear those kinds of things. So, I mean, I hear you when you said the biggest challenge for you was emotional. I'm just asking, did you have to deal with any of those perceptions from people in society, our family and friends that said, that made you feel bad for waiting this long, or even trying to take that decision in the first place? I don't know. Did you deal with that, or was it just strictly emotional?
Like I said to you, I wasn't putting my business out there to everyone in the family. I didn't tell my mom for obvious reasons, and so I couldn't even talk about this until like 2 years after, right?
2 years after the trials for the IVF.
Exactly, because like I said to you, it's a heartbreaking, turbulent and distressing experience emotionally.
Okay.
And it took me not a long time, so that I don't exaggerate, but it took me a while to heal. And I can say that I'm still healing, because one of the things that people don't understand is, in a society like ours, which is pronatal and patriarchal, everyone still looks at you like, oh, you're not married and you don't have kids. Although, personally, I wouldn't say that I am somebody who has had to confront that, because I'm very confident and I'm very assertive. And I don't take a certain level of discrimination. I would fight for myself. I would speak up for myself if I feel or sense anybody coming at me from that. I'm old enough to do that. Maybe when I was in my 20s, I would be more affected. But in my 40s, I'm a grown-up woman. I don't have such people around me, except maybe if I encounter ignorant people out there who will want to bring me down because of that. But no, I didn't have to deal with that, and that's the reason why I didn't tell everybody, because it would be too much stress trying to explain and trying to I didn't need anybody's approval or validation, to be honest.
Okay.
So